If you lose 5% of your body weight, and even that will slow the progression of diabetes by 60%.
Overall, the weight of people, particularly in North America, is increasing over time, and obesity does contribute to the onset of diabetes.
Eating well for diabetes doesn't have to be complicated. It doesn't have to be really difficult.
From the Zoomerplex in historic Liberty Village, the Zoomer with Libby Znaimer.
Welcome to the Zoomer. I'm Libby Znaimer. If you have type 2 diabetes, you're not alone. More than 3.5 million Canadians are living with it, and sadly, this figure is only set to increase. Many more may be unknowingly living with the disease and could go undiagnosed for years. On today's show, we'll explore early warning signs and symptoms, risk factors, and the impact on your heart health, as well as what to eat and what to avoid with type 2 diabetes or pre-diabetes. But before we dive in, let's tee up the topic.
Are you feeling thirsty all the time? Feeling very tired? Losing weight without trying to? We often ignore warning signals that indicate the onset of diabetes. Yikes. But chances are you know someone with diabetes. Every day, nearly 500 Canadians are diagnosed with diabetes, and the majority of these people have type 2. Among those individuals with diabetes or pre-diabetes, 1 in 3 may not even know they have it. Distressing, too, is the reported cost to the Canadian healthcare system, which was estimated at $3.9 billion last year, a number expected to climb to $5 billion in the next decade. The good news, type 2 diabetes can be treated, or better yet, avoided. And there's even promising research showing it can be put into remission with diet and lifestyle changes.
Diabetes has reached epidemic proportions because of Canada's aging population, rising obesity rates, increasingly sedentary lifestyles. Diabetes Canada says 11 million Canadians, and that's nearly 1 in 3, live with pre-diabetes or diabetes, a figure that has doubled since 2000. So, first question, why has that happened in such a short period of time? Dr. Zira.
Well, I think, as was stated earlier, Libby, that the sedentary lifestyle has not done us any favors. Overall, the weight of people, particularly in North America, is increasing over time, and obesity does contribute to the onset of diabetes. So, that's just one of many issues. Our eating habits as well contribute to a diagnosis of diabetes. And in our contemporary world, I think we rely a little too much on processed food as well.
Dr. Gandhi, have you seen a big increase in the numbers in the last number of years, last 20 years?
Yeah, certainly in my own practice, unfortunately, I've seen a significant increase in the number of people with type 2 diabetes, all for the reasons that were stated earlier. I think it's a condition that, as was mentioned in the promo, it's something that we can treat. I think it's becoming a bit of a national emergency. And I think it's something that we need to start focusing on, just like we focused on smoking, 20, 30 years ago. We had all these educational programs about how bad cigarettes were. And I think we need to start focusing on how to avoid diabetes in order for people to live a healthier life.
Sherilyn, you have diabetes, you're a diabetes educator, and you're living with it. So tell me about the process of learning to live with it.
Well, it was kind of hard to process it in the beginning, but with all of the new resources that we have in the technology, living with diabetes has been much more manageable these days.
And so how do you manage it?
So I wear a sensor instead of pricking my fingers like everybody normally does. I wear a sensor now that actually gives me my numbers so I could actually see what I'm eating and how it affects my blood sugars. And there's so many other factors that affect my day-to-day living. So I just find that it's just much easier now to control my diabetes than when I was first diagnosed.
Shannon, I'm assuming that people come to you for nutritional advice to try to prevent or reverse diabetes. How difficult do you think it is for most people?
Well, I think that a lot of people, when they hear type 2 diabetes, they think that the diet has to be really is or would be really complicated. They're concerned about, they have got questions about changes that they need to make. But the good news is that eating well for diabetes doesn't have to be complicated. It doesn't have to be really difficult. And it can actually be really delicious. So, when I do communications around healthy eating, I talk about making small changes and simple swaps.
Dr. Zeroth, one of the things that kind of boggles my mind are the numbers of people who have no idea they either have diabetes or prediabetes. So what are some of the signs?
Yeah, so I often see people after they've been diagnosed with diabetes as a cardiologist. But I think some of the signs, excessive urination, unintentional weight loss as well, that's usually fairly extreme. You can get visual changes too, and non-specific symptoms like fatigue. I think probably Dr. Gandhi has more experience recognizing undiagnosed diabetes.
Dr. Gandhi?
Yeah, so one of the things that I think is really, really important to do is if you're over age 40, at a bare minimum, you should be screened for diabetes every 3 years. And that's whether you have any of the symptoms mentioned before or not. And so it's really important to get your checkups on an annual basis. It doesn't have to be a full physical, but it should be screening for some basic stuff. And diabetes should be every 3 years. Now, that number would increase. It should be more often if you've got a family history, because we know that people who have a family history are more likely to get diabetes. And that number should also increase if you happen to be overweight. So really important to keep a close eye on this.
Okay. We need to take a break. We'll be right back with more of the Zoomer. Welcome back. Complications from type 2 diabetes are vast and can cause serious effects. It increases the risk of a stroke and is the #1 cause of kidney failure. And it can also take a serious toll on the heart. Research shows that those with diabetes are twice as likely to die of heart disease than those without diabetes. So that is a pretty scary statistic. How does the relationship between the two things work, Dr. Zeroth?
Yeah, as you point out, those individuals living with type 2 diabetes do have an increased risk of heart disease. And there's different types of heart disease that can develop in the setting of type 2 diabetes. One major form is coronary artery disease or blockages in the arteries of the heart. And then also they can develop heart failure, which means that the heart muscle, the pump itself, is either too weak or stiff. And so these can all contribute to heart disease in patients living with type 2 diabetes.
What part of the diabetes causes that? Is it excess sugar or what?
Yes, the diabetes, it does affect the endothelium, which is the lining in your vessels. So that makes you more prone to develop plaque or these blockages. But patients with type 2 diabetes also are more likely to have other cardiac risk factors like hypertension or high blood pressure, obesity as well. So all of these increase your risk of cardiovascular disease. Even the kidney disease that patients with diabetes can develop increases their risk of developing cardiovascular disease and heart disease.
Sherilyn, how do you monitor your heart health?
Well, I'm on medications to help me with that too, but I also take my blood pressure, I do my blood tests like I normally do. And I also I tell my patients to go on the My Heart Matters website to ask for more information and resources. So, but that's how I treat myself for my cardiac disease.
And how often do you take your blood pressure?
Oh, not as often as I should, but at least I do it every week just to get a good sense of what my blood pressure is.
Dr. Gandhi, you have a lot of patients, obviously, with these problems. Are they fully aware, and what do you do to monitor their heart health?
So I encourage all of my patients with diabetes to come and see me every 3 months. That's just a basic checkup. You get something called your A1C, which is the way I like to explain to patients, it's basically a 3-month average of your blood sugar over a period of time. Because if you check your blood sugar right now, it's at that point in time, but the A1C is a 3-month average. So I like to have them do that, and I talk to them and I ask how they're feeling. I check their blood pressure. I try and, if appropriate, send for heart investigations if they have symptoms that are concerning to me. And so the best way to do that is through follow-up.
Remind me the number, the A1C number, that's the number you have to be below.
Well, ideally, it does vary with age. Generally for people who are healthy and under age 80, I try to aim for 7% or less. When you get over 80, there can be some people who are frail and over 80, and you may have to adjust that number depending on the person for risk of falls. But for the under 80 and healthy crowd, I would say around 7%.
Shannon, in terms of the diet, is there anything special that is for heart health as opposed to the rest of the whole, the whole gamut of diabetes?
Well, both eating well for diabetes and eating well for heart health are very interconnected. So it would be the same foods that I would be recommending for someone with type 2 diabetes to help to manage their diabetes, but also to help to keep their heart healthy. So for example, we'd be talking about eating more vegetables and fruits. So leafy greens in particular every day. That's one of those foods that I would recommend for everybody every day. If you can get in a leafy green, definitely foods that would be part of a heart healthy and a diabetes friendly diet would also be legumes like lentils, chickpeas, black beans, those sorts of foods, nuts and seeds, as well as some whole grains like barley, for example, and some lean protein foods as well. So looking at all of those foods that are going to give you fiber in particular, some healthy fats, so, fatty fish like omega, or like salmon, for example, for omega-3s. Those are the foods that are going to do, a body good both for diabetes and for heart health.
And is there anything in that list that is hardest to get people to eat?
You know what? We've been trying to move the dial, Libby, on vegetables and fruits for a long time.
Yeah.
And people they're low in vegetables and fruits across Canada. We're low in terms of our fiber intake. So I think that those are the foods that fruits and veggies and whole grains and legumes seem to be foods that, people need to work a little bit more on.
All of them, then?
Yeah, I think those three would be the three that I think people have a difficult time getting in. Veggies in particular, whole grain or legumes like chickpeas, lentils, etc., and those I think and some whole grains as well.
Okay, coming up, we're going to be talking about exercise, and before we get there, Dr. Gandhi, why is exercise so important when you have type 2 diabetes?
Well, exercise is important for everything, right? I mean, it's not just
Yeah.
diabetes, especially for diabetes. Exercise, the bottom line is that it helps your body metabolize sugar better. There's some fairly complicated reactions with how insulin is released when you exercise and using up stuff called glycogen storage that I'm not going to get into, but it basically helps the overall sugar metabolism. But not just that, it helps you lose weight, it helps your blood pressure, it helps your mental health. And a lot of people with diabetes suffer from mental health issues as well because of the burden of the disease. So it's good for a whole bunch of reasons.
Okay, stick around. We'll be right back. Welcome back. Exercise is one of the best things you can do to help manage your diabetes. Joining me to tell us why and to walk us through a couple of routines is Greg Carver, founder and head trainer at Strength Box. It's great to have you here.
Thank you so much, Libby. I'm glad you had me on here. This is what I do. So I'm going to put you through a little resistance training program today. So we're going to do it together. And I want to do a little push, pull, a little lower body. So we'll make it full body, but something everyone can do. So we're going to start off with some lightweight dumbbells. So you have one there. I have one here. You can use dumbbells. Of course, you can use any household object. We're going to start with a curl and press to overhead. So you're going to bring it down, curl under control. We're doing single arm. You could do this 4 repetitions, like 8 to 10 per arm. I kind of like working on intervals. So we're gonna spend roughly almost a minute per technique. So we'll try 30 seconds with one hand, and we're gonna switch to the other hand already. See how fast time goes?
Time flies when you're having fun.
Does. And on this one, you can do it standing, Libby. You can also do it seated if it's more comfortable for you. The most important thing here is not to arch your back. You want to keep a nice flat back, keep your glutes engaged. Curl and press. And we're going to go into number 2 right now. So this is called a crescent row. So this is a pulling exercise. It's a little more difficult with dumbbells. We're going to come into a lunge position. And if you use your forearm, you can support yourself right on your leg here. And you want to square off your hips. The dumbbell goes down, and the first thing you want to do is retract the shoulder. Pull the shoulder blade into the girdle and row. Pull that dumbbell towards your upper stomach, okay? You can use dumbbells anywhere, 3 pounds, 10 pounds, 5, something that works for you. Okay, we're gonna do approximately up to 30 seconds per side. You're also working your legs here too. I can tell because mine's shaking a little bit. We're gonna switch sides, so other foot goes forward. All right, and retract the shoulder, row. How are you finding this one?
Fine.
You're doing a great job. You're doing a great job. Resistance training is really important. It's part of overall exercise. There's many components to fitness. It's not just aerobics. There's strength training, flexibility, balance. It's all important, especially as you get older. Good, excellent. Let's do one more. Perfect, great. Okay, let's lose these for a second because we also have our own weight, body weight. So what we're gonna do, squats. I think squats are so important because they help keep us living independently. You need the ability to get up and down off the floor, out of a chair. If you can sit in a chair, you can squat. So what we're gonna do, we're gonna take shoulder width stance. Weight should be on your heels. You squat as low as you can. My squats are gonna be deep. You squat as low as you can. So we're gonna push our butt down, squat. Excellent. Back up again, squat. When I squat, I wanna try and keep my knees back, so I initiate with a bit of a hip hinge and pull yourself down. Great. So there's a couple ways you can modify these. You can do what I call chair squats, where you would actually sit in a chair and stand up again. The other thing you can do, and I like, is a kitchen sink squat. Grab the kitchen sink, use it for support, pull yourself down, and back up again. Anyone can do that. So good. One more. Perfect. Great. Okay. Core, shoulders. We're going to do walking planks. Let me show you the different ways you can scale it. I'm going to use a chair. This is actually what you're going to use. So what I'm going to ask you to do is have your hands here for support. Feet are about shoulder width apart. This is your plank. You're going to squeeze your butt, keep your abs in, and you're going to tap one shoulder, tap the other. So I'm going to give that one to you.
Okay.
I am going to make it a little more difficult. I'm going on the floor.
Okay.
And we're going to work. Ready? All right. Keep everything nice and tight. So the most basic form of this would be doing it on a wall. So you're just leaning on a wall. The lower you go, the harder the exercise is. And you can see talking and exercising at the same time gets you out of breath. Let's do a couple more. We're doing great. One more per side. All right. How are you feeling?
Fine.
We good so far?
Yep.
Do you know we spent almost 5 minutes so far?
Wow.
Time flies, right? Okay, let's try a hip hinge. This is an exercise called a good morning. We can use the weights for this one. So for this, hip width apart, railroad track your feet, bell goes here. All I'm gonna do, I'm gonna hinge at the hip. Lean forward, I stick my butt back. My knees can be soft, you don't want them straight. So a hip hinge is a basic fundamental body move. Don't go too low because you want your shoulders to be above your hips and nice flat back. So think of keeping that chest out. Good mornings. Good. And we'll do a few more. Feeling this already? Flat back?
No.
Okay, I do. All right. Halos. So for a halo, let's hold them in this position here. This is going around the head, and other side, around the head. All right, this is good for shoulder strength and shoulder mobility at the same time. And you know that...
What about computer neck injuries?
Computer neck injuries. This isn't neck specific. Does this bother your neck at all? Doing this?
I can feel it.
Yeah, okay. Yeah, just any modification you need to make. But again, the ability, you want to get a nice stretch back here, bring it under your chin, and reverse direction. Good. Let's do a couple more. Great. You know you're working when you're sweating, and I'm already starting. All right, let's try another hip hinge.
Okay.
This is one of my favorites. It's called a windmill. So for a windmill, let's take about a squat stance. If the bell is in my right hand, I'm gonna angle my feet both to the right, place my hand on my hip. Again, knees can be soft. All I'm gonna do, I'm gonna shove my butt back this way. I'm gonna hip hinge, trace my leg, come back up again. Again, really important to keep a flat back on this one. You don't use your arms. Let that weight of the bell pull yourself down. This is not just a strength move, so this works your whole posterior chain, but it's also great mobility. You don't want to lose this mobility as you age. It's so important. Let's try the other side. So both feet angled over here, and this time, butt's going back in the corner.
Apologies
down.
to the audience for what we're showing them.
Yeah, it's all good. Back up. You're doing great, you're doing great. Just keep that back as flat as you can.
It's flat.
Good. Perfect. Let's do a few more. We only have one more left, Libby. We're almost there. One more rep. Good. Perfect. Okay. Last one. Easy one. Both hands. Overhead press. Press. And down. Press. Let's do this about 12 times. 3. Good. 4. You can also squeeze the bell if you want to make it harder. Halfway. 6 more. 7. Good. 8. 10. 11. And 12. Excellent job. Can I give you a high five?
Absolutely.
I'd love to give you a high five.
Ooh, that was a very
aggressive high five.
A robust
So
high
what
five.
I would suggest to people, they can do this once, take a break, and you could do this a couple of times. You'd have a great 16-minute workout.
Excellent.
Yeah.
Thank you.
My pleasure, Libby.
We'll be right back with more of the Zoomer. Welcome back. Keeping close tabs on your diet is a major way to manage, or better yet, prevent type 2 diabetes. Here to show us how is our dietitian, Shannon Crocker. Hey, Shannon, what do you have there?
Hi, Libby. So I have got two fantastic recipes today. I'm going to help build a grilled chicken barley bowl, and we're going to take a look at an orange coconut cookie for dessert.
Well, I thought that if you have diabetes, desserts are verboten, so that's good to hear.
Yeah, definitely. We'll talk about that first, but why don't we first build the grilled chicken barley bowl?
Absolutely.
So both of these recipes you can get at carttotable.ca. It's a great resource for people who are just recently diagnosed with type 2 diabetes to help discover the joy of food again, which I think is really important. And you can get shopping tips and healthy hacks and these terrific recipes. So first up, we're going to take about a quarter of your plate, a whole grain. So I've got barley here, and I don't know, Libby, if you usually cook with barley, but it's got a really nice nutty flavor, and it's filled with fiber that's really important for helping to manage blood sugar levels and also for heart health and for gut health as well.
Yeah, I cook with barley, I cook with bulgur, I cook with freekeh and farro, and rice.
Fabulous! So you've got the whole grains covered. So this one here, we've got the barley. We've got about a quarter of our plate with barley, and I'd like to recommend people to actually cook barley on the weekend to do a big batch because it does take a little bit longer to cook. If you have it cooked in the fridge, it's easier to add to salads.
Now, here's the question: do you use the pearl barley or do you use the more, the other stuff?
The pot barley. So you could use either one in this recipe. They take about the same amount of time to cook, which is anywhere between 30 and 40 minutes or so. The pot barley is going to have a little bit more fiber than the pearl barley. So now what we've done is we've added on some arugula. You can use any leafy green that you like. And as I said earlier, I love to get people to eat leafy greens every day. I do use the baby leafy greens that you can buy in those containers. I recommend you buy them when they're on sale, and then have them on hand in the fridge. It's just a healthy convenience food, I think, because then you don't have to worry about chopping lettuce or cutting anything up. You can just add it to your plate, and you can get blends that have more than one type of green as well. So that's a great way to get a few different greens in one meal.
I always have that.
Yeah, perfect. So then what I'm going to do is I'm going to add on some grilled carrots and some grilled red peppers. So think about this in terms of building a healthy plate. We want about a quarter whole grain, as I mentioned, and then about half your plate with vegetables and fruits. So I'm just going to go ahead and add on some carrots that I've grilled ahead of time, as well as some red peppers. So if, again, you have these foods ready, when I cook my vegetables, I always double up and put them in the fridge. So I've got extras to add to meals like this.
And are those veg room temp or warm?
You can do it either way. These are room temperature right now, but you can just grill them and add them into your salad right away, and that's okay. And the vegetables, while we're looking for half of our plate veggies and fruits, that's going to give us fiber. That's also going to give us antioxidants that are really important for heart health as well. So next up, I'm just going to add on some grilled chicken, and I've just actually marinated this chicken in a little bit of chili powder and a little bit of oil, and that actually gives it a really great flavor. And then I grill it, and again, with the protein foods, I always double up while I'm cooking. It just takes no extra time, and it's a big saver when you go to make your next meal. So you could use another lean protein. You could use turkey. You could use salmon to get in some of those heart-healthy omega-3 fats. You could use tofu if you prefer as well. So we want to get some protein in that meal. That's going to help to stabilize blood sugar levels as well. So now we've got this bowl. We've got a quarter whole grains. We've got our leafy greens, our carrots, our red peppers, a little bit of chicken there. And then I'm just going to add a little bit of a drizzle on here with some balsamic vinegar and a little bit of oil just to finish it off. Gives it this great, fabulous flavor. And there you have it, a really easy meal. This comes together in under 30 minutes.
Great. What about dessert?
Okay, so let's move on to dessert. You brought up that question, and I think that's a really valid question. A lot of people ask that, Libby, about sweets, and they assume that you can't actually eat desserts. And the good news is you can still have desserts, but what I recommend is that you have them in with your meal in smaller portions, less often. And I like to have a dessert that also provides you with some nutrients that you need for health. So these orange coconut cookies are made with basic ingredients. We've got oats, dates for sugar, so there's no added refined sugar here, some coconut, a little bit of oil, and then some pumpkin seeds. And to finish it off, we just add a little bit of orange zest. It gives it a nice orange flavor. And you can see here, in terms of the portion size, they're quite small. So that's, I think, part of managing a healthy diabetes-friendly diet and a heart health diet.
How many of those can you eat?
Sweets. How many can you eat?
Yeah.
One is a serving.
Okay,
depending on your appetite, you might have more.
Okay.
Yeah, so there you go. So that's like a really easy dessert. They bake in under 30 minutes. You can keep them in the fridge. You can keep them on the counter for a couple of days. And not only does it satisfy your sweet tooth, but it also gives you some of those nutrients like fiber, for example. There's going to be potassium in these cookies, magnesium in these cookies. So it's going to give you that double duty, giving you the nutrients and satisfying your sweet tooth.
Okay, well, that looks like a really delicious meal.
Yeah, it absolutely is. So we've got the barley bowl ready. That's going to be my dinner after we're done here today. And you've got a cookie, which is what, again, I recommend having a sweet with your dinner or with your lunch instead of just having it on its own. That helps to manage blood sugar levels as well.
Okay, thanks, Shannon.
Thank you.
Right, there's more after the break. Don't go away. Welcome back. As always, we like to get to some of your questions, and really, we were inundated with emails from audience members over the weekend. Quite a few came in, so we are going to read a few of them. Starting with Christine, and she writes, how often should you get your heart checked and by whom? Dr. Zira.
Great. So I do believe primary care is the place to start when you have type 2 diabetes. Most primary care physicians would perform an EKG and based on symptoms then would potentially refer you for additional assessment by an internal medicine physician or cardiologist. For instance, if you're noticing shortness of breath on exertion or exercise, or your legs are swelling, or you're having chest pain symptoms, then you'd be referred on for further investigations at that point.
And Dr. Gandhi, you've said that you like to see your diabetes patients every 3 months.
I do, and I ask them all those questions. I think that's just good basic diabetic care overall. It allows me to keep an eye on their sugars, but it also allows me to monitor for the exact type of symptoms that Dr. Zeroth was talking about.
Okay, next question from Carol. And what is the optimum blood pressure for seniors? Dr. Gandhi, is there such a thing?
As a general rule for people who are diabetic, I know we aim for a systolic, that's the top number, of 130 or less. And for the bottom number, we try to get 85 or less in someone with diabetes. You know, there has to be a little bit of individuality into this, because sometimes when seniors are over 80 again, their bodies are perhaps accustomed to high blood pressure. You bring it down too low, they become lightheaded and, you know, can be more prone to falling. But I think 130 over 85 is a good number to aim for.
For people with diabetes, is it different from the rest of the population?
Yeah, you know, that knowledge is also evolving. Before we used to say 140 over 90 for the rest of the population. Even that number starting to come down a little bit. But I would say let's stick with 130 over 85 to start with.
Okay. And our third question, our final question, Sharon writes in, can adopting a whole food, plant-based diet lifestyle with no salt, oil, or sugar reverse type 2 diabetes? Dr. Zeroth, can it reverse?
Well, I don't think that there have been any randomized controlled trials demonstrating that. However, a diet such as that would likely result in weight loss, likely results in an improved cholesterol profile, likely lower your blood pressure as well. So intuitively, I would say, that type of diet would most likely help prevent onset of diabetes or potentially improve upon your blood sugar control. But again, I don't know if we have any hard science to prove that. Dr. Gandhi, do you recall any studies that clearly demonstrate that? It's a very tough diet to adhere to for some people.
Yeah,
as
my
well.
question was that a lot of people think you have to totally cut out salt. But if you cut out processed food and you use a little bit of salt to make your food taste, that might make you live longer. I don't know, my opinion. I mean, do you tell your patients to cut out salt and oil completely?
So I don't say that, but the amount of salt in a North American diet is excessive, particularly if you rely on processed foods. And there have been large population-based studies in other countries that have shown that using a salt substitute significantly lowered the rates of cardiovascular events, including stroke. So on a population level, at least, there seems to be, some data to support a reduction in our salt intake in comparison to our current baseline levels.
Dr. Gandhi?
Yeah, what I like to counsel people in as far as salt and diet is a little goes a long way. If you lose 5% of your body weight, so put that in perspective, if you're 240 pounds, you're likely overweight for your height. All you have to do is get down to 228, right? 12 pounds. And even that will slow the progression of diabetes by 60%. So however you do that, whether you use a Mediterranean diet, which I think is probably the healthiest diet out there and is what our dietitian was talking about earlier, or if you use some other method, even that little bit will make a big difference. And I completely agree with the comments about processed food. We really need to take a look at our food standards in North America and try and get away from the hyper-processed foods that are offered here.
Right, but I'm thinking that if you cook from scratch, then you can use a little bit of salt. Am I wrong?
No, there's a lot of food out there that naturally occurs that is high in salt. So if you think about your cheeses, pickles, there's a lot of high salt content. Even if you look at your cereal label, there's sodium in there. In bread that you purchase, there's sodium in bread. So I guess if you made everything from scratch, you could be more careful with that. But even naturally produced foods can have some high salt content.
Okay, Shannon, what's your view of that?
Right. Well, over 70% of the sodium in our diet are coming from restaurant foods, takeout foods, packaged foods. So in line with what the other two doctors were saying, definitely we want to reduce our reliance on packaged foods, on restaurant foods, takeout, ultra-processed foods. About 50% of the calories in the Canadian diet are coming from ultra-processed foods that are nutrient poor. So if we can shift to be cooking more at home, you're naturally going to be having less sodium in your diet if you're not relying on those takeout foods and those processed foods. But there is a bit of a caveat. It depends on, of course, some of those foods that you're using at home. Like a lot of sauces, for example, have a lot of sodium in them. So the recipe that I just shared actually had no added salt. There's lots of really great ways to add delicious flavor by adding things like lemon juice or vinegars or, cooking methods that don't use a lot of salt. So it's just learning some of those tricks along the way.
Okay, yeah, fresh herbs. And, hopefully a lot of people have been cooking more because of the pandemic. So hopefully that is a good trend that will help things. And when we come back, final thoughts from our panelists. That's next. Welcome back to the Zoomer. Before we go, let's get some final thoughts from our panelists, starting with Dr. Zira.
Well, I want to say to everybody to remember to know your numbers. So know your A1C, know your blood pressure, know your cholesterol. And if you're one of the many Canadians living with type 2 diabetes, that there are medications available to protect your heart and protect your kidneys as well. So make sure you speak to your primary care physician or specialist involved in your care about that.
Sherilyn?
Well, I would say that living with type 2 diabetes is much more manageable now than when I was first diagnosed. With the advancements of new medications and technologies, it makes life much more easier living with diabetes these days.
Dr. Gandhi?
Yeah, so one thing we haven't talked about yet on the program, and I think should be recognized, and I'm just going to read from the Canadian Diabetic Association website. Living with diabetes can be burdensome and anxiety-provoking, with the constant demands taking a psychological toll. And I think it's important to recognize that 30% of people with diabetes do suffer from depression and anxiety, which will affect their ability to look after themselves and care for themselves. So if you are one of the people with diabetes out there, and if you're feeling down, please make sure you rely on your loved ones. Please bring them into the circle of care, tell them how you're feeling, and speak to your doctor about that, because managing that will help you manage your diabetes.
Shannon?
Yeah, thank you. So I think one of the things I would like to say to people is to don't let this diagnosis ruin your relationship with food. We get such amazing joy from experiencing eating meals with our family, with our friends, and you can still do that. You can still have those joyful experiences, and think about how you can make small changes, sort of one at a time. Don't let it overwhelm you.
So we hope we have given you the information you need about the connection between diabetes and cardiovascular disease. With diabetes, you're twice as likely to have heart issues, and at a younger age. The good news is that it is within your power to reduce and even eliminate those risks. Thank you for being with us. We'll see you soon. It's time to zoom out.